Welcome back to Joy in Our Town. My name is Lisa Boldo, and our issue is health. But in this segment, we're going to focus on dental hygiene. We're continuing our conversation with certified clinical thermographer Tammy Cole-Schmidt. Tammy, thanks again for being with us.
Thank you.
So Tammy, you are not only a thermographer, but you're also a periotherapist.
Yes.
So is there a relationship between what you find using thermography and dental hygiene?
Yes, and one of the reasons we brought thermography into the dental clinic was to track inflammation, because as you know, inflammation is a major problem and cause for disease, and it's disease throughout the whole body, whether it's heart disease, diabetes, or gum disease. So when I would examine the mouth, what's interesting is you don't always see inflammation. It's smoldering, it's burning, it's low. So by doing thermography, I could pick it up in areas that I didn't clinically see with my eyes.
You mean when you're doing a face?
Yeah, and we also do something called an oral microscope test. We test for oral parasites and active bacteria. So I would be able to, you know, look at the thermogram and see where the inflammation was in the mouth, and then test the saliva and kind of marry the two, findings.
Wow.
Because most people, if they have the infection in the saliva, they have no idea. They don't feel it, it doesn't hurt. Meanwhile, that infection is traveling through their bloodstream, raising havoc in all different organs and body parts.
Wow.
So it was really a cool thing to bring together. And then, of course, they both evolved separately on their own into two different things that I do.
Very interesting. You know, we don't typically consider dental hygiene to be a serious health concern. We're always looking at the externals and other different things.
Yeah.
But talk to us about why dental hygiene is now moving to the forefront of medical and dental care.
So this is exciting. There's a whole movement right now called Bridging the Gap between dentistry and medicine. And what we're finding is that doctors are striving to heal their patients from all these systemic diseases, and they can't because they're missing something. In other words, they may get some good results, but then the patient will fall back, or there's just something not quite right in the healing process. And it has to do with hidden inflammation that they're not finding, which is usually the mouth. Again, you can have inflammation in the mouth and never feel it and never know it exists. So the things that we're doing in the mouth, once you can get your mouth cleaned up, you drop your inflammatory markers in your body and you get rid of the infection that's traveling through your bloodstream from your mouth.
So is it sometimes not enough to just clean your mouth?
You mean as a patient at home?
Right.
Well, exactly. It's a start, but you will never know if you have this infection unless you have your saliva tested. There's no way to know. Unless you have obviously issues of bleeding gums, then that's something different.
Could that be a sign?
It's a sign.
Wow.
Yeah, it's a sign.
So what's the correlation between poor dental hygiene and oral systemic disease?
Okay, so poor dental hygiene can mean a few things.
Okay.
If someone tells me I brush my teeth twice a day, and that's all they do, to me that is poor dental hygiene. Because you have to think of your mouth as teeth and gums. So if you're only brushing your teeth and you're not taking care of your gums, you're missing a huge inflammatory issue. So you have to take care of both. Then if you're not getting regular hygiene visits, you're not getting under the gum line cleaned, which is where all of the pathogens hide and nest.
When you say a regular hygiene visit, what does that mean? Getting your teeth cleaned every 6 months, or what does that mean?
Well, again, it depends on what the hygienist finds. Now, most hygienists don't do the depth of work that a periotherapist does.
I see.
So they may just be getting their teeth cleaned and not actually getting gum work.
So what's the difference then between a dental hygienist and a periotherapist?
Okay, so a periotherapist does salivary diagnostics. We test for HPV. We look for oral parasites. We look for active bacterial pathogens. We look at their genetics. We need to know if they're genetically predisposed to gum disease or not. We can test for the pathogens that are in the root canals. all of this matters because all of those pathogens are traveling through your bloodstream. The connection with oral systemic disease, it's proven, there's literature out there for miles, that there is a correlation between spirochetes, which are found in the mouth.
What is that? Parasite?
It's a active bacteria, highly pathogenic bacteria. And it's been linked to Alzheimer's. They're found in the brain.
Really?
So the question is, well, how did it get there? Well, usually there's a pathway through the bloodstream from the gums.
Really?
So now we're also looking at heart disease, diabetes, preterm births, arthritis, pretty much anything, cancer, anything that has an inflammatory response, you have to go back and look in the mouth. You have to.
So let me ask you, because you talked about you might just be taking care of your teeth, but maybe not necessarily your gums. How does somebody take care of their gums at home?
Well, that's an interesting question because you can take care of your gums at home with an oral irrigator.
Okay.
It's a device that has a little squirt gun that you shower around your gum tissue and you clean it out. That will get rid of the free-floating bacteria. It will not get rid of the nests. There's something called a biofilm, and these bacteria build this protective layer around them. It's a nest that they live in.
Really?
And so when they leave the nest, you can free them, you can get rid of them with the water, but it takes lasers and it takes deep cleanings to actually break up the nest.
Interesting.
Which brings me back to being a periotherapist. We do laser therapy. That's one of the most effective ways to break up the biofilm.
And then how often does that have to be done, or does it just depend on?
It depends on the severity of the issue.
Okay.
It depends on the type of pathogens. It depends on their genetics, their predisposition for inflammatory disease. And it depends on their clinical signs and symptoms. I sometimes see patients for 6 months, every 2 weeks, then every 6 weeks. I mean, it can be intense.
Depending on how severe the situation
Yeah.
is. That's
Yeah.
amazing. So is there a gap between dentistry and general medicine?
I believe so, and that's what we're trying to fill. Again, as a periotherapist, we do look at the patient's blood work.
Yeah.
So regular hygienists really don't take that into account as much. So that starts to bridge the gap.
You said you look at their blood work?
Yeah, we want to know what their CRP markers are. We want to know what their plaque 2 score is. We want to know their D3 levels.
And do you take those tests?
No, that's again, we stay in contact with the patient's doctor.
Excellent.
Yeah, so that we can talk about the case. If they're trying to heal from heart disease and they have a mouth that is unhealthy, they're not going to heal.
Wow.
They're going to be at a higher risk for the next cardiac event. So,
Wow. How important is nutrition to oral health?
nutrition is huge, and if I can lump some things together with nutrition, we also have to look at their pH, because if their tissues are acidic, once again, the healing's going to be compromised. I need to know if they're exercising. I need to know how they're sleeping.
Yeah.
I'm also interested in if they breathe through their mouth or not. If they breathe through their mouth, they're going to have another hidden form of inflammation.
Wow.
Because mouth breathing lowers your CO2 levels. Imagine a can of soda. You pop it open and it's fizzy and it's got a lot of life. As the CO2 levels go down, the soda becomes flat and lifeless. That's what's happening in your body when you breathe through your mouth. Wow. You deplete your CO2 levels. And then that causes inflammation. But it also causes your tubes, which is your digestion and your arteries and all the lymphatic, to become really tense. So now you're looking at hypertension and stagnation throughout the whole body.
Just from breathing through your
Just
mouth?
from breathing through your mouth.
Oh,
So nutrition is a big part of it. Obviously, you have to do things to take care of your bones. I would say vitamin D3 is one of the top supplements.
Sure.
Vitamin K2 is another top supplement to keep the bone and the teeth healthy. Vitamin C for the actual tissues, the capillaries. It's a big deal.
So nutrition is a big deal.
Yeah.
So do you have some tips that you can give us to keep the mouth healthy?
Yeah, so let's go back to irrigation, which I talked about.
That's the spray.
Yeah, that's the little squirt gun.
Okay.
So if you are just flossing, you're doing good at removing food, but you're not going to remove infection. You're not going to remove the bugs because floss only can go around the neck of the tooth, and a pocket in the gum goes much deeper. So you're missing it.
So it's more important to do the irrigation.
Yeah, because the water can float under the gum line and clear out the bugs. And food. It does both.
Okay.
So a healthy tip would be throw away your floss and get an irrigator.
Really? You don't
Yeah.
need to do both. You can do one or the other?
Exactly. I wholeheartedly believe in water picking or hydroflossing.
And anyone can do it? Do you teach people how to do it just
I
like you would
do.
teach someone to floss?
I do. I teach them how to do it. And it depends on when to do it, depending on their mouth. And, you know, floss is great after lunch if you can't brush and you have food caught.
Yeah.
Definitely. But it's not for disease.
Right.
Can't heal.
So floss is kind of a surface thing, but...
It is, yeah.
Okay. So you talked about the importance of nutrition and you talked about the importance of exercise. And for what? To reduce the inflammation?
Exercise reduces your cancer risk by 50%.
Wow.
And it's because you're oxygenating.
Ah.
Oxygen kills cancer. Oxygen also raises your pH. So again, if you're an acidic person, oxygen will come in and help to balance that.
So if you've got acidic tissues, that's going to deplete your oxygen
Well,
as well? Or?
Acidic tissue causes inflammation,
Yeah.
and it harbors bacteria because bacteria thrive in acid.
Oh, and that's good. And then in your mouth, if you're doing mouth breathing, do you feel like more bacteria can get in there as well?
Oh yeah, it's a
As opposed
breeding
to-
ground. Yeah, it's more tooth decay for sure.
For breathing through your mouth.
Uh-huh.
And when you breathe through your nose, I know I've heard it said that the filters keep the...
Yes,
Keep
so
the-
exactly. It filters the
air.
the bacteria, the viruses. It moisturizes the air so that when it gets to the lungs, but it also creates a nitric oxide response. So it's good for the heart.
What about that thing I've heard of with oil pulling? Do you think that's a good idea?
I do. I love oil pulling. You can do oil pulling. You should do it, excuse me, first thing in the morning on an empty stomach.
So how do we do that?
So you take like a tablespoon or 2 tablespoons of coconut oil, put it in your mouth, and you just swish. Like, you just keep swishing. But you have to do it for like 10 to 20 minutes.
Okay.
So you can do it while you're in the shower.
And then
know.
spit?
And then spit.
And if you can't hold it and you just do it, you're okay, right? You're
Yeah.
you're gonna still get some benefits,
yeah,
right?
spit it into the trash, not into your sink, so you
Oh.
don't clog up the sink.
Or into the toilet.
Yeah, don't do that.
So,
But oil pulling's great. It pulls toxins out, especially chemical type toxins.
excellent.
Yeah.
Tammy, thank you so much for being with us.
you.
And thank you for watching Joy in Our Town. We'll see you next time.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, Post Office Box A, Santa Ana, California, 92711.